Hey guys, it's Kirsten. Hope everyone's home and safe and well. I just wanted to use a couple of your minutes to talk about silver diamine fluoride. It's the advancement in dentistry that I really wanted to learn a little bit more about. So let's dive right in. I'm sure lots of you actually have a lot more exposure and know more about it than I did. Working in dentistry, it's possible your dentist utilized its capabilities. So for those of us who don't really know much about it, let's learn a little bit. Silver diamine fluoride has been used extensively outside of the U.S. for decades for caries management, especially in Japan. It's been used for 80 years. In other places, it's been used for 40 years. But it's a fluoride, so it's a colorless liquid that has silver particles in it. It has a pH of 10. And our fluoride varnish has a pH of 7, a neutral pH. It reduces those cariogenic bacteria, and it's going to promote remineralization while inhibiting demineralization. SDF is a non-invasive alternative to our traditional drill and fill, quick and easy to apply. It is applied like you would apply fluoride, but site specific. If there's a caries lesion, that's where you would apply it. I know non-invasive alternatives are becoming more popular, and so this is one of those alternatives to filling a cavity. So the history in the U.S. in 2014, the FDA approved it for the use of silver diamine fluoride for hypersensitivity. And then in 2015, so it was approved in August of 14. In April of 15, the first product became available, and that is created by Elevate Oral Care. And the FDA granted Elevate Oral Care the manufacturer breakthrough therapy status, which would facilitate clinical trials of SDF for caries arrest. And this designation represents the FDA's effort to address an unmet, serious, life-threatening medical need where there is no available therapy, and to expedite the review of such products. So this is a great designation that was given to Elevate Oral Care and Advantage Arrest, because there are a lot of we know there are a lot of people who are walking around with active caries lesions. And so having this available to us is incredible. So what is SDF made of? It's made of 25% silver. And as we know, silver has the ability to kill a bacteria. It has water in it as a base, fluoride in it, and we all know what fluoride does. It's so amazing. And then the ammonia helps that solution. So it's maximally effective. So the really cool thing that I learned about this, so that silver will remain within that dead bacteria of the tooth as a reservoir, so that if a future bacterial attack takes place, the silver will reactivate, preventing the new live bacteria from restarting the cavity. This condition, known as the zombie effect, has the dead bacteria essentially killing off the live bacteria, thereby preventing further decay. This allows a definitive solution to decayed teeth, preventing the risk of root death and the need for more invasive treatment such as a root canal and crown. So we all want to know what the side effects are for anything that's new, any medication, any new therapies that are out there. So the side effect for SDF is black staining. It's going to stain any caries lesion black. There is some temporary discoloration of the gingiva or the mucosa, or if you get it on your face or your hands, it's going to temporarily turn that brown up to a couple weeks, maybe, like a henna tattoo. But you can use Vaseline before you apply the SDF, you limit that exposure. But that's our only side effect, is that staining. So and it's so effective for high-risk patients. It's 91% effective at arresting decay when applied biannually. And so that is an incredible effectiveness. So why are we not using it more? Here's some pictures of what it looks like before it's applied and then after it is applied. You can see it's going to stain black. There are some newer technologies or new ways of, or additional ways of helping to discolor that. We'll talk about that in just a second. But why are we not using this more? Why don't we know about it a little bit more? And some of the places I've found say that clinicians don't recommend it, maybe because it's our own perception of what the patient or the guardian wants for their own oral health. It's our own perception that they don't want this black stain. However, when the alternative is to schedule another appointment, facing some injections, a rubber dam, drilling, the sounds of the drill, the smells of the drilling. So when we take a few minutes to explain these alternatives that can have a profound impact and can be a relief to the patient and the patient's family, because some of those other things are quite scary, especially if you are working with someone who needs a lot of behavioral management, or a young child who is difficult to get back in, or an elderly adult as well. So like I was saying, there's some things we can do to help lessen the stain, the amount of stain. Initial studies show that adding potassium iodine significantly reduces the staining. However, additional larger studies are recommended. The potassium iodine very minimally, if at all, reduces the effectiveness of SDF. And there are places that we'll put a glass ionomer over top of this then too, to cover up the black staining. So what makes this desirable? It requires absolutely no special equipment. It's easy to apply, no need for air, water, or instruments. It's non-invasive. The clinician, we're able to slow the progression of decay at the time of diagnosis. Our patient comes in for an appointment, we do all of our treatment, the doctor comes in and we talk about their options if there's a carious lesion, and if they decide to move forward with the SDF, you can apply it right then, and they walk out of the office knowing that there's not a need necessarily, depending on the patient, to reschedule or come back, or so traumatizing dental experiences can be avoided, especially for our patients who fall into these following categories. Those who have behavioral management issues or special needs, patients who cannot afford extensive restorative work, and the patients who are fearful of dentists and will not seek needed treatment. I'm sure there's lots of us who have had patients in our clinic who have a need restorative work, have active carious lesions, and we know that they come to us because it's a free service, and they probably will be back for the next class with those same carious lesions because they can't afford the restorations, or they're have a fear of a dentist, and we are a safe place for them. So it's just something that maybe we need to have more conversations about. But the cost side of it. So according to Elevate Oral Care's website, an 8 milliliter bottle costs $220. And that bottle contains 250 drops, and one drop treats 5 surfaces. Therefore, less than $1 per drop to treat these cavities. It's pretty phenomenal what you're able to do with that dollar. And Approximately 30 states cover the use of SDF under Medicaid. So if you're contraindications, silver allergy, and oral ulcerations or exposed pulp. So otherwise, go for it. And it can be billed through. We have a code for it. There's actually a couple different codes we can use. This 1354 is very specific. Obviously, interim carries arresting medicament application per tooth. So you can bill it pretty easily. And excuse me. So conservative treatment of an active non-symptomatic caries lesion by topical application of a caries arresting or inhibiting medicament and without mechanical removal of a sound tooth structure. That's pretty amazing. SDF fits right into that. There are a couple other options that can be used for applying SDF here, the 1208, the 9910, or the 1999. And this can be used for someone who has hypersensitivity. It can be used for that as well, and build out that way too. So how many of our patients could benefit from silver diamine fluoride? I just think of the ones who come to our clinic. We're providing them a really great service, and they have the sorry, my dog's at the door. I lost my train of thought. They come to us because it's a free service. So, and maybe they don't have the resources to seek dental treatment. So how, so it's just something to think about, and how many of us are going to be able to see this many patients in the future for free. So I'm going to put a link here. Hopefully you can click on it. If not, I'll put it within my discussion board too, so you can. It's just a minute and a half long. It shows us how to apply it. She basically says everything I said, but condenses it down to a minute and a half. But I hope that this was helpful. It was for me, because I think that's such a great product that we have access to, and hopefully the ability to use it and help our patients. I was listening to a podcast a couple months ago about a dentist who uses SDF quite a bit with her pediatric patients, and she found that it was financially beneficial to her practice because her hygienist could apply it. And for those patients who are really harder to manage, and we're looking at sedation dentistry, and when you're getting into sedation dentistry, you're tying up an entire day where the dentist would typically have that whole day to see a number of patients, and so financially she found it was beneficial for her to utilize this and have this discussion with her patients about the benefits of SDF. So it's a really, really great thing, and I hope you guys enjoyed, and thank you so much.